Hi, I'm Dr. Steve Greene from Advanced Dermatology and Laser Institute of Seattle. Today we're doing a very exciting new treatment for the treatment of keloid scars. Keloid scars are a type of scar that is extremely active and grows very actively beyond the original injury that caused the scar reaction. We commonly see keloid scars in our patients who come from more ethnic backgrounds, and Seattle is a home for many international communities. We see it commonly in our patients from Latin America, Asia, and in Africa, as well as India. Today we're going to use a technique called CRYOSHAPE, and CRYOSHAPE uses a deep administration of liquid nitrogen. Instead of spraying liquid nitrogen on the surface, which in the past has not been helpful in reducing keloid scars, we instead are using a technique where we actually use a probe that we put underneath the keloid and then connect it to a tank of liquid nitrogen, send it through, and then create cell death of the keloid. And over about 3 to 6 weeks, the keloid actually falls off. And then the skin heals nicely, and somewhere between 50 and 75% of cases, the keloid does not come back. Today our patient has actually had a CRYOSHAPE treatment on his left posterior shoulder, and that area is healed very nicely. And today we're going to do another treatment here for his chest, and he has been numbing already for about an hour in preparation for our procedure, and now we're going to do some deeper numbing before the actual procedure. Now we're going to put some local anesthesia for the next level of comfort. We're going to use some distraction vibration in the skin while we do our numbing. Thank you. Okay, here we go. Here. Good. I think everything is really numb. So we're getting the CRYOSHAPE probe ready for placement to the bottom levels of the keloid. This area has been properly anesthetized, and we'll be doing this in likely two different areas for complete and comprehensive treatment today. What we're trying to do is create frostbite, and we'll actually get to see all the stages of that in today's treatment. Very good. So we have placed the probe through the keloid, and we're going to now take gauze and protect the normal surrounding skin with gauze. And yeah, that's good. That's terrific. How are we doing? Good. Okay, so we're going to time also, and here we go. We'll start now. So everything looks really good. We can hear and actually see that the liquid nitrogen is passing from the tank through the CRYOSHAPE probe. And it's this deep freeze that will cause the keloid scar to come away in the coming weeks. For care approach and numbing techniques, this becomes a really very reasonable treatment to do in the outpatient setting here in our office. We can see that we're freezing here nicely. We have been doing CRYOSHAPE treatment for several years now in our practice, and we've had excellent results. Sometimes a patient will come for treatment for a single keloid, oftentimes associated with a previous history of acne or maybe a cut or a scrape to the skin. and if they have a genetic predisposition for a keloid to develop, there seems to be a ignition key that turns from that injury that then tells the collagen factory in the skin to proliferate and in this instance over proliferate. And you can see how nicely the keloid scar is freezing here. This is beautiful. After the procedure, a patient does not experience any pain whatsoever, and usually any discomfort that's experienced the evening after the procedure, it's usually mild to moderate and can, in almost all instances, be remedied with some simple extra strength Tylenol. The most common areas where keloids occur are the chest and the shoulders and the upper back. We think the tension on the skin in those areas where we're kind of stretching our chest back and our back forward, that sort of tension is contributing to turning on keloid in those areas. There's like a triangle on the chest from shoulder to shoulder down to the middle of the sternum. That triangle of area tends to be the most common area that people will experience keloids there. So now we're going to do the second part. I can report to you that we're about 60% done. And we just have one portion that we want to do a little extra work on for you to get total freeze. In the early days, liquid nitrogen, which is the chilled gas that is used for freezing many things in dermatology, like warts and so on. Some investigators started using it to treat keloids, and in some cases it was helpful in some very superficial, very thin keloids, and that treatment was used either alone or in combination with injections with intralesional Kenalog, a corticosteroid. But other investigators wanted to try to get a more comprehensive result and felt that not enough previously of the keloid was frozen adequately with just superficial spray. And so they developed a probe like this to be able to chill and freeze the keloid from underneath up and sort of inside out, if you will. And that's what we're doing today. And from our experience using the CRYOSHAPE technique, we're able to get 60, 70, 80% complete benefit. And it doesn't work in 100%. So we tell everyone that. But when it works completely, it's a really wonderful result. And we can always go back and do another treatment if necessary. And we're able to see actually with our eyes the very intense freeze which is necessary to achieve for best results. So this is great. How are you feeling?
Good.
Are you feeling any pain at all?
No pain.
Good. Okay, I think we are done. Today we're concluding our treatment of your mid-chest keloid scar. And if others have questions and interest in learning more about the treatment of keloid scars with CRYOSHAPE, please get in touch with us at Advanced Dermatology and Laser Institute of Seattle. And we'd be more than happy to consult with you and give you the latest experience and technique information on the treatment of a very difficult problem, keloid scars.